Partnered by Times Influence.
Ladies and gentlemen, doctors and respected friends from the healthcare industry, it gives me great pleasure to invite you to the India Today Excellence Awards 2018, Maharashtra. The India Today Excellence Healthcare Award is an unique attempt to study, record, and to recognize the commendable work done by the healthcare industry. India Today tries to look at the best practitioners and institutions in a region and honor them for their contribution to the society. This is a humble way of saying thank you. Without much ado, may I request Mr. Anil Fernandez, the Associate Publisher of the India Today Group, to come on stage and take forward the proceedings.
It is a pleasure to welcome the leaders of the healthcare industry. It is indeed satisfying to know that we all are in safe hands. The India Today Group has always been in the forefront when it comes to acknowledging the contributions of individuals and organizations to society and celebrating their success. We believe success begets more success, and would like to applaud more people from your fraternity. To evaluate and classify the best doctors or hospitals is always a challenge. To acknowledge and appreciate your good work, we have with us Dr. Deepak Sawant, the Honorable Minister for Health from Maharashtra. It is indeed a pleasure to have with us a health minister who is a doctor by qualification. A man who knows the subject and the need of the hour is also the right man to applaud your efforts on behalf of the people. He is very passionate about organ donation. In fact, he has been practicing it quite seriously. May I now request the minister to address the audience, please.
India Today has organized this program to recognize your talent, your efforts, your excellence in the field of the healthcare. There are so many hospitals which are rendering the services in all throughout the Maharashtra. You must have considered all the hospitals which are giving the small hospitals, big hospitals, nursing homes, daycare centers, and whatnot. These hospitals are necessary for the rendering the service because alone the government cannot cater such kind of services. No doubt we are catering around 6 crores of the people all throughout the Maharashtra in primary, secondary and tertiary healthcare. We have got 2 super specialty hospitals in Amravati and Nasik, where everything is done which is considered to be, which comes under the banner of the super specialty. The city called Amravati, our doctors have undertaken a first kidney transplant in the history. Never before in the history of the government hospital, any transplant, kidney transplant, especially the PhD department, that is the public health department, nobody has taken this kind of thing. But in my tenure, I am fortunate to have such a good team of doctors, those who have taken the first kidney transplant and successful kidney transplant. So I am proud of my department also. Definitely we will be doing, we are not stopping at only at the kidney transplant, but liver transplant and heart transplant also. So we are preparing for that. So I don't want to keep my department limited up to the contagious disease, NCDs and all these things, but I want to take this department ahead and ahead. I congratulate all the award winners, those who have done the wonderful job and at par at their excellence. Thank you very much.
With such an august gathering congregated in this room, we are keen to make the most of it. So we have lined up a panel discussion, the topic for which is timely too, the changing dynamics in healthcare.
The theme today is changing dynamics of the healthcare. Let us start with the senior most, that is Dr. Lalit Kapoor. Sir, you have seen actually the changing dynamics of what is happening over the years He has almost completed 50 years of practice. So what is your bird's eye view of the changing dynamism of healthcare practice?
There has been a sea change in the way we practice medicine earlier and the way things have metamorphosized now and changed very, very rapidly. Essentially, the doctor-patient relationship has changed tremendously. Whereas in earlier days, the doctor-patient relationship was what is called a paternalistic one. But over the years, this paternalistic pattern has given way, of course this is all over the world, into what is called patient autonomy. That the patient is master of his body. He has a right to decide what he would like to do. So the duty of the doctor is merely to explain to the patient that, look here, this is what is wrong with you, this is what you need, this is what will happen if you don't do what I tell you, these are the things that can go wrong. Now, having got all the information, you have to decide what you want. So this is one big change that took place. The doctor-patient relationship has eroded tremendously over the years, and particularly the Consumer Protection Act 1986. After this act brought in the medical profession into the jurisdiction of this act, that is the time when the patient became a consumer. So there was a consumerization of the patient. The doctor is now referred not to as a doctor, but as a healthcare provider, as a provider. And healthcare became a commodity. Apart from that, there is corporatization of hospitals. We have corporates who have now started hospitals. There are several changes, I can go on, but I think things have changed tremendously, and therefore we need to cope up with these changes.
I would like to ask Harsh. Harsh, you are a chartered accountant, you're an IM, finance MBA. You have been dealing with a lot of healthcare people, whether it comes to funding, etc. So when an investor thinks about healthcare, what is the kind of perspective they have? Because the government is trying to pull us down when it comes to the generation of the income. And the investor is only looking at how early can I get out and get my investment out after making my profit. So what is your thoughts about that?
So from an investor's angle, what we've always observed, healthcare has always been the long-term pot of gold. Industries have evolved, technologies have evolved, and healthcare, for some reason, from an investor's angle, has always been a little late to the party. And it's been a sunrise industry for very long. And when I say healthcare here, I mean services, not the pharmaceutical aspects, but the service aspects of it. So if you look at all, say, from a public markets perspective, the hospital stocks, or the health tech startups from the non-public, the unlisted space, investors do understand that this is not, unlike a consumer stock, this is not a 2-year story or 3-year story where either the brand is made or the brand is not. It will take 10, 12, 15 years before a return comes in. That long-term horizon investors have.
I'm going to ask Dr. Alok, this question, because he's also running a hospital. He has also been in a governmental setup where he has actually headed the neurology department in one of the municipal corporation hospitals. Correct me if I'm wrong, sir? Right. So you have a perspective of both the sides. So what is your take on the whole thing?
In a country like ours, public health and private health need to go together because there will be a significant chunk of the population who cannot afford private care. And so our government hospitals, our medical colleges are actually doing phenomenal work in providing completely free of cost care to people who have absolutely no money. So both need to go hand in hand. But over the last 30 years or so that I've been practicing, there has been a big shift in the middle class aspirations. Earlier we had, just 2 choices, but now you have an evolving middle class that wants quality service, that wants the best. And with, with the internet and with what we call Dr. Google, people have an awareness of what is available out there. So nowadays when patients come to us, they have all the options in their head even before they talk to us. They actually know much more about the latest advances and they come and ask, is this available? Why is this not available? So yes, the aspirations have gone up, and but the thing is, both of these have to function simultaneously, because there is a need for both of them in our society. You cannot completely nationalize health like in the British system. You cannot completely privatize health like in America. Both need to go completely hand in hand.
Madam, what do you have this perspective from the changing healthcare scenario and the financial aspect? How is the pharma industry getting affected?
The major problem that we have been facing across from last 3 or 4 years from the pharma perspective is the frequent change of policies which are coming in. And it's too fast for them, and their profits are really going down. For any of the pharma company, if they're present, they would realize it. The profitability which has come down. Some of them, government policies are brilliant. Fixed drug combinations, yes. You had a price control, yes, but you can't be controlling everything. I mean, even for a stent, for that matter, for that hospitals, it's becoming very difficult to operate with that kind of a costing which is coming down if you're going to curb somewhere. It's not been a very easy, but what rightly said is we are at a very interesting time in our country. We are evolving. We are going to make certain mistakes, but I think after some time, it's going to be a 360-degree thing where we'll come back, take a couple of steps ahead, come back, evaluate our mistakes, and maybe a balance has to come in. So it's a very, very interesting stage right now, both for pharma, both for physicians, for everyone here.
Let me ask Dr. Naren, how are you using technology in your setup?
Clearly, the fundamental piece in any tertiary or quaternary care hospital is the technology which, as you said, assists in delivery of precision, and by default the safety level increases. This is direct impact on patient treatment. You will find new softwares coming in the other aspect, which is the softer aspect, not the harder aspect. Data, big data analysis, predictive analytics, there are newer and newer softwares coming in. Yes, you have the AI piece coming in, which with the explosion of data which is available and facts to a practicing physician or even a nurse, it is difficult to process all this information and come to a conclusive diagnosis or preliminary diagnosis. And definitely this is an area where technology is going to play a huge role, because when you talked about patient safety, you have data from the United States of America, 2012, 2014, that a large part of adverse events in hospitals is because of human error. Errors not just in doing procedures, errors in analyzing data and facts. Most of these are linked to an inability to process data and take proper decisions. So one is the use of technology to enhance your skills and safety. The bigger piece is going to be the data analysis, assisting you in taking decisions, not replacing you. This is a great myth that it is not replacing you, it is assisting you to come to better conclusions, to look at things with a greater perspective, and this is where it's all going to change. We have a long, long way to go in patient safety.
Brilliantly put, brilliantly put. I think we'll wrap up this session with quick take-home messages from all panelists. We'll start with the youngest one first.
What I'm experiencing currently, obviously patient care is changing, but the patient experience aspect, it's a wave. Every day I meet different startups as I'm part of one myself, but the kind of stuff that people are doing increasingly, I think as doctors it is important to understand this wave as to where it will be headed 10 years from now, because doctors are very quick to adopt to technology in treating patients, but they need to adopt to technology in the patient experience aspect as well.
Thank you. Mamta?
I think we are in a very, very interesting place now, and the way the evolution is going to happen, both at the patient care, physician level, technology assisting us, we're going to make mistakes, learn from them, but still I think it's going to be a beautiful phase to be in.
Dr. Kapoor sir.
I think as citizens, we must realize that the government spending on healthcare is extremely poor, and that is one We should not allow the government to get away with it, to not spend enough money on healthcare and then to blame the people who are trying to do something.
Dr. Alok sir.
As a medical fraternity, we need to be united. We need to, stand together, understanding each other's points of view. Very often, when there's a new disruptive technology like stem cell therapy, it threatens the established practices. And the people whose practices are threatened, because with stem cell therapy, many things which were incurable now become curable. So then the people whose medical practices, or even the pharma industry, which depends on medicines for these, they get threatened, and then they oppose it and criticize it. Our fundamental thing has to be what benefits the patients the most. And we have to always look at ourselves. What would I do if I was a patient? Would I take this? And if we look at everything from that point of view, we will be able to make the best and the most effective technologies available. Engaging the government, engaging regulators is an important part of that.
Brilliant. Dr. Ramnarayan sir, last but not the least.
Yeah. I think it's a laudable effort. They want to make healthcare accessible. They want timely, effective treatment to be given to patients. We have an aspirational class. We are aware of all that. But the only thing which we will have to fight for as an industry is affordable is not just for the patient. It must be affordable for the provider. If it is not affordable to the provider, there is going to be no service. So it's very nice to say accessible, affordable, assured healthcare, but would somebody look at affordability to the provider? That is where the crux of the issue is going to be when we are at these crossroads. If it's a public-private partnership, if it is affordable, if it is reasonable in terms of providing the care, then we will get where we want to. Otherwise, the system will break down, it will remain as a white paper, there will be execution issues, and it will just fade away into the background.
If we do not change with the change, we perish. If we change with the change, we survive. If we bring about the change, like many of us, we are going to be the leaders. Wish you all the very best. Thank you very much.
So we come to that time of the evening when we are going to be recognizing the winners. So can we start off with the first awards, which goes to Excellence in Multi-Speciality Hospital from Mumbai. The winner is Kokilaben Dhirubhai Ambani Hospital. We move on to Excellence in Social Contribution in Healthcare in Maharashtra. It goes to Dr. Usha Kakade. The next award is for Excellence in Cancer Care, and the hospital is HCG Apex Cancer Center. The next award is for Excellence in Lifestyle Nutrition and Holistic Health from Mumbai, and the winner is Dr. Naomi Shah. We have for Excellence in Cardiology from Mumbai, the winner is Dr. Rajesh Rajani. The next award is for Excellence in Stem Cell Therapy from Maharashtra, and the winner is Neurogen Brain and Spine Institute. The next in the sequence is for Excellence in Diagnostic Center from Mumbai, and the winner is iGenetic Diagnostics. Continuing the sequence, we have an award for Excellence in Cosmetic Surgery from Mumbai, and the winner is Dr. Parag Telang. The next award goes to Excellence in Mother and Child Care Services in Mumbai and Pune, and the winner is Cloud9 Hospital. The next in the sequence for awards is for Excellence in Genetic Lab Services from Mumbai, and the winner is Lilac Insights. The award for Excellence in Eye Care Hospital from Mumbai goes to Orbit Hospital. The award for Excellence in Ophthalmology from Pune goes to Mahaveer Eye Hospital from Pune. We have as the next winner, Excellence in Pharmacy from Mumbai, Wellness Forever Medicare Private Limited. The next award goes to Excellence in Women's Healthcare from Mumbai, and the winner is Women Hospital. The next award goes to an individual, young achiever from Mumbai. We have Dr. Mukesh Gupta. And the last award for the evening today goes to an individual again, Excellence in Coach for Psychology of Eating, Diet Planning, and NLP expert from Mumbai, Navidi Vadra. Thank you very much. So I would request you to stay on stage for a couple of minutes more. We are coming out of the coffee table book on all these inspiring people, so we'd want you to just unveil the book as well. Winners, why don't I call all of you back on the stage with all our trophies? We would like to have a photograph to remember the occasion with. It's been a remarkable evening. A big thanks to all of you for having made it to this event and been with us for the celebration. Thank you. Thank you very much.
I'm happy that the field of stem cell therapy got acknowledged. India today, by creating an award of excellence in stem cell therapy, has acknowledged the importance of this very new, exciting and pioneering field of stem cell therapy, which is making a difference to thousands of people's lives.
Well, I think the winning factor is unconditional patient care, basically, not worried about what the results are. It's a good going by India today, and through healthy competition, the standards will increase and medical care will flourish.
हमारा यूएस के फाउंडेशन बेसिकली हेल्थ के ऊपर बहुत ज़्यादा काम करता है, जो कि बच्चों और महिलाओं के लिए हम लोग काम करते हैं। एंड 80,000 बच्चों का डेंटल चेकअप विद सर्जरी किया है। 1,10,000 बच्चों का हमने आई चेकअप विद सर्जरी किया है। और अभी हमारा एक गुड टच बैड टच जो बहुत ही महत्वपूर्ण सब्जेक्ट है, वो हम लोग अभी फाउंडेशन के द्वारा कर रहे हैं।
We're doing some exemplary work in the cancer care space, and I think it's the good work which we are doing for the patients here in the city of Mumbai, which has led us to win this award today.
I'm really excited. I think it's really nice that the work that we're doing is being appreciated. I think anyone in healthcare cannot achieve what they achieve without a team, and 100% of credit goes to our team at Women's Hospital.
Partnered by Times Influence.